We use the word comprehensive, we're referring to treatment of all age groups for all conditions related to the spine. We do the necks, the thoracic spine, and the low back. We treat spinal deformities, and we treat just low back problems and just neck problems. As far as scoliosis goes, we do take care of kids and adults. The majority of back problems, neck problems are non-operative, even scoliosis. You don't operate on most of them. They get braced. The goal of most of the people here is to keep the patients away from me. I'm the surgeon. I'm the person you don't need to meet. You probably don't want to meet unless you have to. My part is, okay, we've decided you need surgery. Now, how do we do it? How do we do the least amount of surgery to get you the most benefit?
I had scoliosis. I had it in my thoracic and lumbar curve. I was diagnosed when I was 15 years old, and I had surgery when I was 18.
The surgeons here are all trained in spinal deformity work. Scoliosis is the most obvious one. What I've found in my experience with spinal deformity surgeons is they think about the spine differently. They think about it more in balance as a three-dimensional entity, not as a front and a side x-ray or an MRI scan. You're saying, if I do this procedure, this small surgery to this particular part of the spine, how is it going to affect the rest of the spine? It's just a different level of training, different level of experience.
Dr. Von Ruden performed back surgery in March of this year. He corrected my thoracic curve only, but it also corrected my lumbar curve as kind of a counteract thing. So I didn't have to have surgery on my lower half because of that.
When you see a young girl with scoliosis that needs a brace, all they're thinking about is, I'm going to be different than anybody else. She's worried about the short term, the brace, what her friends are going to think. Her parents are worried about, how is this going to affect her life? I want the best for my children. I've never met a parent that if they could wear the brace for their daughter for scoliosis, they wouldn't do it.
My parents were very impressed with Dr. Von Ruden. Apparently, through my surgery, he came out and talked to them and made them feel, safe, that they had their little girl in his hands. If I had gone to anyone else, I don't think I would have gone through the surgery.
Nobody wants to have surgery, but again, the good news is you have a fixable problem. And if we do this and we go through it, we will get you through it. You will be happy and you will be able to go back and do the things you want to do.